Dr. Vinod Kaul is a well-known general surgeon currently associated with many reputed hospital and clinic in Delhi, has 46 years of experience in laparoscopic surgery and proctoloscopic surgery and proctology, and worked as an expert in different cities in India.
Hello everyone, I am Sari Mekbar from Media 9 Network and you are watching India's first doctor-oriented show, Doctor Opinion, and opinion really matter. Now today we will discuss about the laser hemorrhoidectomy versus conventional hemorrhoidectomy. And for this we have a very renowned personality from the health fraternity, Dr. Vinod Kaul. Welcome to our show, sir.
Thank you.
Dr. Vinod Kaul has a 50 plus experience in this field. He is the best
40 plus
experience in this field, and is the best surgeon and laparoscopic surgeon in Delhi. So what is laser hemorrhoidectomy and conventional hemorrhoidectomy, sir?
Thank you so much for asking and the time taken by you to convey to my people and the health conscious people and the people who are suffering from piles. First, I will give a small introduction. What is pile? The commonly people call it piles, and in our medical terminology we call it hemorrhoidectomy. Pile is a Latin word which means a ball, a mass, which comes out of the anus. And hemorrhoid means blood, roid means a running blood. A person who has piles or hemorrhoids, once he passes stools, what happens? He sees a flash in the pan. Blood drops are seen in the pan. He says, where from this blood is coming? When he consults a doctor, he says him, you have piles. This has been there for many years, and pile is a very common disease in West because they consume a lot of non-veg and their habits are altogether different, and they were very affluent, they are affluent countries. But now the same disease has come to our continent, to India. The lifestyle has changed. People take fast foods. They indulge in a lot of trans fats, foods which lack fiber, which lack a lot of vegetables, fruits, and take the junk food. So, plus they remain constipated. And some people, it is in heredity, the walls of those blood vessels which bleed are weak. So what happens? We have a part in the anal canal, above it 1.25 centimeter, which is called rectum. It has certain veins which are called as rectal veins, or also called hemorrhoids. Now a person who is constipated or who strains, these start dilating. Once they start dilating, then they start elongating. वो लंबे हो जाते हैं. Since वहाँ जगह नहीं होती, there is no space, they become tortuous. And a time comes when by the heart stool they start bleeding, and patient gets the bleed and finds out is very worried. But if he neglects this, then these piles become so enlarged that they will come up to the anal canal. But in some patients they become so enlarged that they remain outside the anal canal, which is called as prolapse piles. So we have graded them. First degree, where nothing is seen, while defecation, you only have bleed. Second, when they come up to the anal canal, go again back. When they remain constantly, they are called as third degree, or we call them prolapse piles.
Right.
So
right. थोड़ा सा मैं आपको रोकना चाहूँगा कि ये बेसिकली काफ़ी कॉमन चीज़ है आज के दौर में, तो बहुत ज़्यादा देखा जा रहा है ये बीमारियों को. तो बेसिकली इसका मेन सबसे बेस्ट ट्रीटमेंट क्या है सर, कि मतलब इसको किस तरह से इससे
फॉर इयर्स हम क्या करते थे, हम कन्वेंशनल वी यूज्ड टू डू व्हाट वाज दैट मैस, उसको काट के उसमें स्टिचेस लगाते थे जिसका नाम था एक्सीजन लाइगेशन. ना क्या होता था, ज्यूरिंग सर्जरी हम पेशेंट को एनेस्थीसिया देते थे, उसको पेन नहीं होता था. उसके बाद वो पेशेंट जो ही पेन का असर खत्म होता था, he will be in severe pain. He had to be in the bed about 5 to 7 days, and there used to be stitches, and then aftermath there used to be a scar. So we used to say patient that it is going to take you to be perfectly alright more than a month. Now with the advance of the laser, these things have totally changed. It has transformed. You will see that a laser, what is a laser? Laser, light amplified stupulated emission of radiation. What we do, we actually throw the cathode rays and they are reflected back onto a mirror, and the beam is focused on that area and they vaporize the whole pile mass without leaving a scar, without leaving pain, and patient recovers within 1 or 2 days, is up to the work immediately within next day, and he doesn't feel any post-operative pain or bleeding. And it has totally transformed the treatment of hemorrhoids.
So, what is the advantage and disadvantage for laser hemorrhoids and conventional hemorrhoidectomy?
Yes, let us first see which is modern nowadays. Laser hemorrhoid, pain is minimal. It is minimal. Stay in the hospital is absolutely 1 or 2 days. It is aesthetic. There is no scar. While as conventional, there are stitches. The admission is for 5 to 6 days. Pain remains for a long time. Post-operative complication, you can have a stricture of the anal canal.
So, patient recovery इसमें कितनी जल्दी होती है दोनों में अगर कंपेयर किया जाए?
लेजर में हमने देखा है, I have been doing it for so many years. Between 1 or 2 patient is up and about. He doesn't feel even if he has undergone surgery.
Right.
While as in a conventional, it takes time to heal patient, and this is a sensitive area. He has pain. We have to give him painkillers, and it lasts for 5 to 7 days.
So, what is the complication and risk, common complication and risk associated with laser hemorrhoid and conventional hemorrhoid?
See, what we have seen with laser, the chances of infection are very low. Because if there is any present bacteria also, that also vaporizes, that also goes. So there are least bacterial contamination. Number 2, sometimes if the piles are very big and they are very tortuous, they may be hemorrhage, which can be very much controlled. That is, while in the conventional, usually we have seen there can be hemorrhage, there can be slip of the ligature, there can be later anal stenosis, there can be pain and infection.
Last question, sir. How do you educate patient about difference between laser and conventional hemorrhoid?
It is very important. There are so many doctors or so many medical people who deal with piles. Some are educated and trained, some are uneducated. As we say, the coax or say like some, they get their own treatment, and the people usually land the patient into trouble. At that time, they may feel they use a ligature method, which has to be tied and removed and tied and removed for a long time. That is seen by, I've seen some of the Bengali coax doing it, or some of the conventional. So, while as doctors who are not trained in laser, who don't know, as you have, I can show you, this is the laser machine. This is the laser machine. We connect it to the electric counts. You can see it. We connect it to the fiber here. That fiber removes out, and we focus it on the targeted area, and it is all automatic. You can see, once I say laser therapy, it comes like fissure ablation.
Right. Can you show our camera?
Yeah, you can see it. It is fissure ablation, and you will see this is on. The laser beam will start coming out. It will alleviate the area. It will just dilate that area, and you will find out that the sphincter, which is undergoing a spasm, will have some. Will be having some fulguration of that, and it is over. It takes hardly few seconds. Remove it, and then take out this laser, take away, keep some ice pack so that there is no damage to the, because of the heat generated to the surrounding tissues. The procedure is over.
It's a very unique, sir. So, तो मैं चाहूँगा सर थोड़ा सा आप अपने बारे में बताएं, ताकि आपको लोग अप्रोच करें. इतनी मतलब इजी चीज़ और इतनी आसान से कि ये बीमारियां जो दूर हो रही हैं, पहले काफ़ी कॉम्प्लिकेशन थी इन चीज़ों में, तो मैं चाहूँगा थोड़ा सा आप बताएं कि आपको लोग.
Thank you. I'm Dr. Vinod Kaul, who has done my MBBS from Government Medical College Srinagar in 1979, and thereafter I have done my MS in 83, Thereafter, I came back to Delhi while I worked in Gangaram Hospital till 96 year. 96, I migrated to Saudi Arabia. Was there for 5 years in Sabtal Alaya Hospital, Aba General Hospital, which was a medical college associated hospital in Saudi Aba region. Then thereafter I came to UAE, Dubai, where I was working in an American company. It was an American hospital in the near Emirate Malls. Thereafter I came back in India and I established my own clinic in Old Rajendra Nagar. Here I got attached to various hospitals. The biggest hospitals around at that time were with me was the MGS Hospital Punjabi Bagh. Then I joined Jasara. Thereafter another hospital which was associate of Apollo Millennium Hospital, Pusa Road, which is now the ST Hospital. I worked there. I was a senior consultant at all the three places. Thereafter the BL Kapoor Hospital came up and I joined BL Kapoor Hospital. Thereafter recently I have left Primus Hospital, Chennai Puri. Right now I am associated with Fortis Ashlok Hospital, which is now taken by Health Reach People, First Health Reach People, and I am associated with agencies like Hexa and Pristine and First Year, where I am operating in Jeevan Mala and Delhi Heart Institutions, and we carry out regular laser surgeries for fissure, piles, varicose veins, fistula, and other things. Nowadays we are using laser even for promotion of the diabetic wounds, non-healing wounds. It has so many benefits for revitalization and we have got very good results. I have a lot of data with me and I personally feel I say my junior young colleagues to take up this and learn this and carry on. The best way is to relieve the patient of his symptoms without any complications. That is the aim of every health worker, especially a doctor.
Great, sir. Thank you so much, sir. Thank you so much.
Pleasure talking to you. God bless you. It was very nice interaction. Thank you.
Thank you so much.
Thank you.